joined by Doctors Ifeanyi Nsofor, who is a Director of Policy and Advocacy at Nigeria Health Watch, and also by Dr. Abiye Kalaiwo, who is also a medical practitioner. Gentlemen, you're welcome to Transition 2019.
Thank you so much.
Thank you very much.
Just to let our viewers know that Arise News put up about more than a dozen phone calls to Dr. Chris Ngige, inviting him to this program to explain more on his expose about Nigerian doctors that they could emigrate with a text message. They still remain unreturned. In fact, before going on air, his phone has been switched off for over 8 hours now. But these gentlemen are capable of tackling his statement and the state of the Nigerian health system. Dr. Ifeanyi, let me begin with you because you have this experience even in the pandemic called, the Ebola scourge and the rest. How do you react to the statement of Dr. Chris Ngige, someone who himself a medical practitioner?
Yeah. Okay, so I think, first of all, it's really embarrassing, and quite unfortunate that a doctor of his experience, and pedigree within the sector, could make that kind of statement. And I say this because if you let's look at data, so there are 72,000 doctors registered by the Medical and Dental Council. 35,000 are working in Nigeria. 37,000 out of the country. Even if we had all the 72,000 doctors in Nigeria, it will still not be enough to meet the WHO recommended standard. In fact, if you break it down further, we need about 300,000 doctors to meet that recommendation by WHO. So for him to come out to say that, I think it really smacks of, some level of irresponsibility. And I think personally, I think that he should retract that statement, because we know what it is like for a lot of doctors in the country now. A lot of people are leaving the country. About an average of 12 doctors per week. So for him to come and say that, that's not the case, then it's quite unfortunate.